Hi, this is Dr. Peter Hartmann. This is another video on psychiatric topics for the general public. This one is on postpartum depression. Postpartum means simply after the birth of a baby. Now this time I'm using a different computer and I'm not able to have a video of me while I'm talking that will show in the right lower corner of my video. So I put my picture in so you'll know that it's really me. So what is postpartum depression? Well, it's a serious form of depression that usually begins a few weeks after delivery and then can last for months without treatment. It can begin any time after birth, and it's considered postpartum depression if woman develops depression within the first 6 months after delivery. Some authorities say up to a year. Now, what the woman is experiencing is a sad, down, depressed mood, along with a lot of anxiety, often some irritability. And a few women actually have no feelings. They are simply numb. They will cry for no apparent reason, often for long periods of time. They will tend to withdraw from family, from the baby. They may not want to get out of bed. They struggle with guilt, often about whether they're a good enough mom. They may have some fears that they may harm the baby. And in the worst case, they may develop suicidal thoughts that even act on them. And unfortunately, suicide is one of the leading causes of maternal mortality in the United States. Most of the women who develop postpartum depression have had a major depressive episode at some time previously. Now, there is a form of postpartum depression that fortunately is quite rare, and that is a psychotic depression. Frequently, this is due to bipolar disorder, but it can be major depressive disorder with psychotic features. In this case, the mother may hear voices, but more likely just has delusional thoughts. For example, that the baby is, inhabited by the devil, and that the baby will go to hell if it dies once it's an adult. And therefore, she hears this voice telling her to kill the baby, to save the baby, so the baby will go to heaven. So this is one of the reasons why sometimes mothers kill their infants. And it's a tragedy. It deserves psychiatric treatment. It does not deserve to be in the criminal justice system. Now, there are other times when a woman may kill her infant, and that's different. That does deserve assessment by our criminal justice system. Now, having postpartum depression creates significant problems, and the most serious one I've already mentioned, and that's suicide. But there are three others I'd like to mention. The first is suffering. The mother suffers. It's terrible to feel depressed and anxious and irritable and not wanting to get out of bed, to lose interest in things, to not be able to experience normal pleasure, to have trouble sleeping. So suffering is a significant problem. A second one is that during postpartum depression, the maternal-infant bonding does not normally occur as it should. And this is a significant problem for both the mother, but especially for the infant, who needs to bond with the mother. And the third problem is that women with postpartum depression typically have less success in breastfeeding. This is a problem for the baby, since the baby may not get the benefits of breastfeeding, which includes that kind of close contact with the mother that releases oxytocin in both of them, which is a bonding chemical. And also, if the baby is put on an artificial formula, the baby won't get benefits from breastfeeding, such as the antibodies that help protect it from infections. Now, there's a condition that some people may confuse with postpartum depression, and that's the baby blues. It's very common, 3 out of 4 pregnancies. It's not a psychiatric disorder. Rather, it's an understandable reaction to the sudden drop in hormones that occurs after birth and the necessary adjustment to having a new baby to take care of. The women may not sleep well, often has some mood swings, may cry, but usually for brief periods of time, and feels anxious. But these down feelings and anxious feelings are intermittent and not severe. Typically, baby blues begins 2 or 3 days after birth and lasts for a week or two and then go away. This is quite different from postpartum depression, where the onset is usually later, that is to say a few weeks after birth, and goes on for many, many months unless it's treated. So what are the risk factors for developing postpartum depression? The most important one is a history of having postpartum depression with a prior pregnancy. In fact, having depression at any time in the woman's life increases her risk. Having depression and anxious feelings during the pregnancies that isn't quite as bad as it takes to rise to the level where it would be considered a major depressive episode, nevertheless increases the woman's risk, and that woman deserves increased monitoring so that she can be treated as early as possible. Stress of almost any time can cause an increased risk for postpartum depression. The most important one is inadequate social support. This is particularly from the significant other, but also from family, friends, your minister, priest, rabbi, or also your doctors and other healthcare providers. Conflict with the significant other is considered a significant factor. Domestic violence, no surprise there. If the baby has special needs or has a difficult temperament, that increases the risk of postpartum depression. Financial problems can also be a factor. And surprisingly, having a cesarean section increases your risk of postpartum depression. And that's true whether the cesarean section was done through a plan or it was an emergency. And of course, there are many other stressors in life that also increase the risk of developing it. Now, it's noted that if a woman is experiencing these significant stresses about 6 weeks after pregnancy, it predicts the development of a depressive episode at 3 to 6 months. So that woman needs to be observed. Here's another one that I want to specifically mention, and that's cigarette smoking. Although more and more women, when pregnant, are smoking marijuana with the false belief that that's perfectly safe. It isn't. But smoking cigarettes is not only a health risk to the mother, but it also increases a mother's risk of developing postpartum depression by about 1.7 times the normal rate in the community. Bottom line, don't smoke when you're pregnant. Now, there are some risk factors, and we've mentioned them, but there are also some protective factors, things that reduce your risk of developing postpartum depression. And what are they? The number one protective factor is a good social support network. Good nutrition helps, something like a Mediterranean diet with fish. Fish includes some zinc, and there's some thought that low zinc levels in mothers may also contribute to postpartum depression. Adequate sleep is very helpful. Exercise and physical activity also is protective, and this should be done during pregnancy. Now, if a woman has had an episode of postpartum depression in the past, she may want to have a conversation with her doctors about whether or not to start on an antidepressant during the latter part of her pregnancy in hopes of preventing another episode of postpartum depression. Okay, so now we know what it is and what are some of the risks and some of the protective factors. What do we do if a woman develops postpartum depression? How is it treated? Well, one important option is the use of medications. Before any medicine is prescribed, however, the doctors must first determine whether or not this form of depression is due to bipolar disorder. If that is the case, it's treated very differently than unipolar depression, which is the more common form. In fact, antidepressants do not help the bipolar form of depression. If it is the more common unipolar major depressive disorder, then antidepressants would normally be prescribed. The one that most of the experts in the area prefer is called sertraline, or the trade name is Zoloft. Why? Because it's well tolerated. It's considered safe during pregnancy and for breastfeeding. In fact, when they measure the level of this medication in the baby's blood and also in the breast milk, they find it's virtually not present at all. Now, if the woman is already on an antidepressant and is providing some benefit, then you may not want to make the change, but just adjust the dose as necessary. Because postpartum depression tends to be a rather severe form of depression, it would not be unusual for the mother to need more than one type of medication. But that's something that you would work out with your doctor, of course. Now, interestingly, there is a new medication for postpartum depression that works quite rapidly. It's called Zulresso. The generic name is brexanolone. It's been approved by the FDA if a woman develops postpartum depression within 4 weeks of delivery. It's a medicine that's given intravenously over a 2.5-day period. And because of a couple of serious potential side effects, that is excessive sedation, but also the sudden loss of consciousness, it's necessary for this treatment to be done in a hospital setting where the woman is continuously monitored. So the woman is going to be in the hospital for about 3 days. Usually, this treatment resolves the depression, so it's a phenomenal thing. It's not available everywhere, though, because it requires special training and the necessity of insurance approving it, and it is quite expensive. But it is a novel and interesting new form of treatment for postpartum depression. Now, another very important form of treatment for postpartum depression is the psychotherapy, the talking therapies, and there are a variety of them that are highly effective. Some experts believe that a particular form called interpersonal psychotherapy is optional for postpartum depression, but cognitive behavioral therapy and many others are also quite effective, and which form of therapy to use is up to the therapist and the patient. Now, if the woman has very low motivation, just doesn't want to get out of bed, doesn't want to do anything, there is also a form of treatment called activation therapy that can be very helpful in that case. And this is something that the therapist can use along with interpersonal therapy, cognitive behavioral therapy, or whatever form of therapy they feel is best for that particular patient. And therapy is not instead of medication, and medication is not instead of therapy. They are ideally used together. And it's my belief that every woman with postpartum depression should have therapy from a professional therapist. Now, there are other treatments for postpartum depression. These usually are not considered unless medication and the therapy, the talking therapies, are not sufficiently effective. They include the use of bright lights of a special type that are also used for seasonal affective disorder. There's another treatment that's sort of illustrated in the picture, and that is transcranial magnetic stimulation, or TMS, which basically just means that a special magnet is placed up against the skull in a particular place, and a magnetic impulse is provided that helps to relieve the depressive disorder. The treatments are done roughly 5 times a week, and it may take a few weeks. They last only a few minutes. There's no anesthesia needed. It's painless. However, you may have a mild headache sometimes that can be treated easily with over-the-counter analgesics. It is expensive and does need to be approved by your insurance, but they are more likely to approve it than that other medication that I recently mentioned. Now, if the postpartum depression is particularly severe and intractable and all the treatments we've mentioned have been ineffective, and especially if the woman has a psychotic form of depression or is very suicidal, we can turn to ECT, or electroconvulsive therapy. And modern ECT is done under anesthesia. A muscle relaxant is given, so there's no jerking movement seen. It is extremely safe and highly effective, and it can be used for any form of depression. It can save a life. So that's a quick overview of postpartum depression. I've covered the nuts and bolts. There's a lot more that can be said about it. So if you have comments or suggestions or questions, feel free to include them in the comment area below. And feel free to subscribe to the channel if you want to hear more of these videos. And thank you for your kind attention.